This is a case study development on a patient that I'm doing. My patient's name is Mr. Smith. Here's a picture of Mr. Smith, if you can see him. Mr. Smith is a white male. He's 46. He's 6'1", 296 pounds. He's got a BMI of 39.05. He's married to Molly Smith. They have 3 children that are alive and healthy, and he's got 1 grandbaby on the way. He lives in a small, rundown 2-bedroom home in a lower-income neighborhood. He's currently retired, and his wife is retired. She's also working just part-time, just what she can to make a little bit of money. He comes in today with cough, fever, body aches, and a productive cough that's like brownish in color, and also shortness of breath. Medical history: he's got hypertension, diabetes, hyperlipidemia, and COPD. I'm trying to do these so you can kind of see them too. Surgery-wise, he's had an appendectomy and a tonsillectomy. Since Mr. Smith has had a productive cough, fever, body aches, and shortness of breath, I did a chest x-ray on him, and the x-ray shows pneumonia. I'm going to prescribe an antibiotic, Levaquin, a steroid, like a dose pack, and a cough syrup, Bromphed DM. Current medications: he uses a Noro, which is an inhaler used for COPD, Dalaresp, which is an inhaler for COPD, fish oil over the counter. He uses that to help decrease his lipids and cholesterol and his glucose. And he also takes glucosamine over the counter, used to help decrease glucose. My plan was to keep him on all of his meds. I don't see any interactions between the ones that he's currently taking and the ones that I planned for him. A few of the ones that he's taken, it says he needs to, if he has diabetes, to check with his doctor, which I think they're still okay to take, as long as he keeps an eye on his sugars. The steroid that I'm giving him, it can raise his sugars, so he'll need to keep an eye on his sugars while he's taking that medication, and also probably on his kidney function. We could probably also eliminate the steroid if we had to, if he couldn't tolerate it, and just have an antibiotic, or if we had to, we could also eliminate the cough syrup if he couldn't tolerate that or his blood sugars became elevated. I wouldn't take him off any of his current meds that he's taking, just because he's been taking them for so long. So I would possibly just maybe eliminate the steroid and the cough syrup, and just see if we could get going with the antibiotic. If we couldn't clear it up with the antibiotic, then I would say we'd have to add those 2 back. I just hate doing the Medro dose pack. It's good for infection, helps clear that up, but it's also hard on diabetes. So people with diabetes, it really can increase their blood sugars and make them out of whack. So if he could do without that, I would probably just maybe not do the dose pack and just do the antibiotic, as long as that would cover it. So he's going to keep an eye on his labs, especially his glucose and kidney function. He's going to let me know if he has any other issues. And that's all I have on Mr. Smith. My back page is the references. I've already sent you a copy of this PowerPoint. Here's a picture of Mr. Smith. As you can see, he's got COPD, and that's a picture of him using his inhaler. These are just some of the demographics. Like I said, I've already told you these, and I've sent these to you in an email. And I think that's it for my Grand Rounds presentation.